Good afternoon, everyone. Welcome to Yodo. I'm Dr. Lisa Tartaglia.
And I'm Dr. Sarah Baum. We're here today to talk about healthcare surrogacy.
That's right, healthcare surrogacy.
So what is the healthcare surrogate? You want to tell me a little bit about what the HCS?
The healthcare surrogate is when you pick a person to be in control of your healthcare when you are no longer able to make decisions.
So they don't make decisions for you while you still have the ability to make decisions for yourself. And maybe you can't make every decision for yourself, but you want to be involved in the healthcare decisions. You need to make sure you choose your healthcare surrogate wisely.
And that person needs to be very confident in their decision-making capacity and be strong-willed, because when you no longer have capacity, or if you're unresponsive and not able to make your needs known, you don't want family members to come in and
give them different directions. So you want to choose somebody that you trust. You want to choose somebody that knows you well. So this is not the same thing as a will or a trust. This has nothing to do with money. The healthcare surrogate does not have any access to your funds. They are the people that would, or person, that would help the medical team choose what's right for you when your health becomes in trouble, in serious trouble. Because now you've reached a point where you're not able to make a decision for yourself. Hopefully by now you've already established what quality of life means to you, so that the person who's making that decision is confident that they're making the decision that you would want.
So it's really important to talk to that person before you get sick, right? And really make sure that your needs are known and you're constantly re-talking about it, because as your
it's an ongoing decision.
It's ongoing, and things evolve and things change.
Yeah. And you have the right to change your mind, and your healthcare surrogate needs to be somebody that will listen to you about what is important to you. So the healthcare surrogate should not be judgmental and say, oh, you don't want this, or you don't want that, or you do want this, you do want that. You can't quit. You've got to keep on trying. You're a trooper. You're a fighter. Because it's your decision as to how you want to meet the end of your life. The reality of it is we are mortal, and we are all going to die. And so we want to have the best death that we can, because you only get one shot at it. That's why you only die once. And having only one shot at it, you want it to be a really good death that's in your time. I think it's normal to want to live. And so when people say, I'm not ready to die, I understand that. I think that that's normal. If you say I'm ready to die, then I got to wonder, why would you say that now? What's happened in your life that would make you ready to die? Because everybody should want to live. That's the normal.
Yeah, and what can we do to make it better? Because
we want your life to be the good quality. We want you to be able to live each and every day to the highest quality, to the highest satisfaction that you possibly can, given the setting of serious illness.
Right. And also, just so you know, once you make the decision of who your healthcare surrogate is and you have that in writing, it can change.
Yeah.
So if you decide that person is not going to follow your disease trajectory as you would like it, or you think that they themselves get sick, or they might...
Or maybe they've passed.
Yeah, they may have had some changes and they may have passed. Then you can change that.
You can update your healthcare surrogate form, so you're not locked in with that. You still have to retain the capacity to name who that person is. And, unfortunately, we have illnesses now that take our mind from us. We have different dementing illnesses that prevent us from being able to think in the same manner of how we used to be able to think. And I don't mean that you don't recognize family members or know what's important, but some neurologic diseases will cause you to not be able to think in a manner that you used to be able to think in. And that's why it's important to have that friend, that family member, know what you would want, and that's going to be your healthcare surrogate. They're only going to make those decisions for you. If you reach that point in your healthcare, the decisions need to be made, and you're no longer able to make those decisions. You now lack capacity.
And I even find with dementia patients, even as their disease evolves, it's good to keep them included in the discussion, or allow them to be present during the discussion, because we don't really know what they're understanding and what they're not understanding. But oftentimes they can answer simple things like, do you want to go to the hospital? No, I don't want to go to the hospital.
Even if that means that you're going to die, well, I'm going to die anyway. So I have had patients that have a dementing illness and they may not realize who they are or what their occupation used to be, but they still know what's important to them about life. And many of them find that they have been active their whole life. They have done things for themselves, for others, for this country. They, were business leaders. They were the matriarch of the family. And to them, their identity is being that active, mindful person, and being put on a machine or have a feeding tube put in them and then slowly dying over a period of weeks to months is not how they want to go. They want to be comfortable, they want to be in their own home, and they don't want to have those kind of life-sustaining treatments administered to them at the end of life. That still means they have capacity. Now, they may not understand the treatment that is being offered, and that's where the surrogate comes in.
They have an understanding of the treatment, and then they will follow through with what you originally would like.
So a patient may have a dementing illness and may not realize the year or the month. They may not remember if they had a breakfast early this morning or what was on that breakfast, but they may still be able to communicate what's important to them. And they have that capacity to know that I still want to be able to, get around in my own home. I still want to be active. Then the surrogate is going to say, well, the treatment that you're offering is going to prevent those things.
Exactly.
And so that's not what we're going to want. They're going to want to be kept comfortable because they want to remain in their home. They don't want to be transferred back to the hospital for another surgery because they're going to decline from the surgery. So a healthcare surrogate doesn't make a decision that you haven't instructed them to. And that's where they have to be a strong individual because they're going to be getting information from other people, whether it's family members or friends, that are going to maybe try to influence them that you should do that procedure, or it's okay to give them CPR, or you should put a feeding tube in them, or they just need one more transfusion, or they've been on a ventilator before. And they don't want that anymore. They have done those things before in the past, but now this person has instructed me that they don't want those treatments, that the goal of care now is for comfort focused care, and they don't want to have those kind of heroic interventions.
Right, and they want to make sure that person is going to just follow your wishes. So that's why it's very good to have it in writing, just to help them understand what you really want when you're well.
Give them some different scenarios. If they say, oh, you've got to have a procedure done and I don't do well with the anesthesia, then yeah, maybe you would want to have everything done for 5 days, for 7 days. But if I am not able to recognize you and start making decisions for myself, then I'm going to have you change that status. The healthcare surrogate does not make those choices for you. The healthcare surrogate is to tell the physicians, what your choices would be in a situation where you can't speak anymore. And the talk that I usually like to give to the healthcare surrogate is that this is a tough job. It is not your job to choose for them. It is your job to tell me what they would choose if they could speak now.
Yeah. So I always go back to, even when I have the unresponsive patient, I always say, this is not your decision. What would they have wanted? If your mother could stand up right now and tell us, what would she want? And that kind of helps them also, because it's a big burden for the healthcare surrogate to carry. They can harbor a lot of guilt, especially if not everyone in the family is in agreement.
And especially if they haven't had that instruction, that this is what you're to do and I'm instructing you to do it for me. I think that being a surrogate is an honor, but it's also a burden. And so the patient can help ease that burden by telling you, these are the circumstances, this is what I would want. Because then when you're raising your voice and you're telling the other family members, no, they don't want those things, or yes, they do want those things, you're not choosing it based on what you want.
Yeah, and there's an understanding there. So it's really important.
An example that I can give, once I cared for a very elderly lady that was in an assisted living facility. She didn't live with her son, he lived nearby, but she felt like she wanted to have as much of her own person and her own identity as well as her own personal space as possible. So she did not want to live with her son and his family. And she was in her 90s. She would get up in the morning and she would go right outside into the gardens, and she'd start working in the gardens and pulling weeds and planting things. And she just loved being outside. She would come in during the heat of the day after lunch, and she would rest and maybe take a nap, and then she would go right out again after dinner, and she would work until either the mosquitoes got too bad or until, it got evening time and ready for her to go to bed. And she had established that she did not like doctors. She did not want me to listen to her heart. She did not want me to wear my white coat. She did not like it when I took her blood pressure, and she did not like to take medicines. She would take a Tylenol periodically if she felt like she had a headache. She did not want any supplements. She liked to eat natural foods and felt like she would get enough vitamins and minerals out of that. So she had laid a clear demarcation about likes and dislikes. Well, she was, like I said, considerably older than 90, and her ambulatory skills were declining. I get a phone call from the facility that she was ill, and I was going to be at that facility that day, so I told them I will see her when I get there. And she was minimally responsive. She was able to recognize me and say my name, and I offered her to go to the hospital, and she said, call my son. So I called her son, and I told him, I think that she is, very ill. I suspect an infection because she was running a fever, and she did recognize me and instructed me to call you. And he was just in a quandary as to what to do. And I said, I can take, my best evaluation, and I can do some tests on her here, but I can tell you that if she goes to the hospital, she's going to get much better care, much more aggressive care, and a lot more thorough testing. Because here, I can get a blood test, I won't have it back till tomorrow. I can get a urine test, I may not have it back for 2 or 3 days. And I can put her on an antibiotic that's my best judgment as to what antibiotic to put her on. But I can't tell you that any of those things are going to be enough, as ill as your mom is and as frail and old as she is. And he said, again, gosh, I'm really, stuck as to what to do because my mom doesn't particularly like doctors, and I know she hates hospitals, and she's been proud that she's never been in an ambulance. And I said, well, as the surrogate, your decision is not yours. Your decision is you're telling me what your mom would want. What would she want now? And he said, that's easy. He said, she would say, if you can give her an antibiotic, do that, but she would not want to have to go to the hospital. So because I thought she was at the end of life because of this acute illness, I enrolled her in hospice. We put her on an antibiotic. The hospice nurses came that evening, and because she was in crisis, they put her on continuous care, and she received antibiotics for a few days, and she actually rallied and improved. Right. So she did get better. Now, she wasn't able to get out to the gardens anymore. She really had what we call a chair-to-bed existence, but she was pleased that she was comfortable. She was not happy with the outcome. And so she did end up within a few short weeks, within about 5 weeks of that infection, she ended up having a natural passing and died during her sleep. But the son felt so good because he didn't make her go to the hospital. He didn't make her have the lab drawn. This was a lady who was an executive's assistant. She was a secretary for a major department store executive. And she made all kinds of decisions when she was younger and told them that those were the decisions of the executive, but I think they were probably hers just from her personality. And she knew exactly what she wanted and didn't want. And so because she had explained that to her son, he did not have to bear that burden of making those decisions without her instructing him. So she had told him what she wanted, and she told him in words and in how she lived her life. Mm-hmm. So he said, that he felt comfortable making those decisions.
And then you were able to see her pass peacefully.
She had a nice passing, as good a death as could be expected. She was, in her 90s. She got to die what she called in her home, in her room, in the assisted living facility. She had hospice nurses and staff and aides that were attending to her, and her son was able to come and visit her and spend time with her. And she didn't have blood work. She didn't have tubes placed. Mm-hmm. She didn't have CPR because she was like I said, one of those people that just didn't like doctors or didn't trust doctors, and she did not like all that testing, and she didn't like medications, and liked to live her life in a natural way, and she wanted to have her death in a natural way. So the son, being faced with those decisions, send her to the hospital and help her live, or allow me to care for her here in this setting within the constraints of how she preferred to live her life, even if that means the end of her life is going to occur. He agreed to that. And we were fortunate. We were able to treat her infection. She got better for several days, and was able to get up, not really go independently out to the gardens, but she was able to get up and be in the facility around her friends, and then had a natural death in the night several weeks later. So I just felt like that was such a success for her, and really took that burden off of him, because he had been given such good instruction from her how she wanted to be cared for, and then she had lived her life true to how she wanted to live her life, and didn't get really upset at the last minute that now I want to live my life differently.
Right. And I think these stories, that when we recount stories about our patients, it's just to help you all understand that we've seen many different sides of healthcare surrogacy. Some are not as pleasant. Some have a lot of angst, but this is somebody who really made their goals very clear to their child, and their child honored their wishes. And what more can you expect from a mother and a son?
Right.
It's a wonderful thing.
We want everybody to have the best life possible, and live as long as possible, because that's the natural thing, is to want to have life. And we want you to face death only once. We want you to have a comfortable, natural death, and a death with dignity. But only you can define that. Only you can answer those types of questions. But I think it's really important for you to share that information with at least one person that can be your healthcare surrogate. I would prefer for everybody to have a surrogate and an alternate, and then they both be informed about what your goals are. You don't have to name every possible scenario, but just like this patient had never told her son, strict information about her, but he extrapolated from how she lived her life and what he knew, how she felt about physicians and how she felt in general about healthcare, that he knew what the decision would be and what that right decision for her would be.
Well, I think we did a really good job discussing healthcare surrogacy today.
Yeah, we talked about who they are and what their responsibilities are, and that you, as the patient, you can decide to choose another person, or if something happens to that healthcare surrogate, then you certainly should choose another person. So that's a good review of healthcare surrogacy, and that they're not going to take your money. They don't have access to your bank account. It is only for healthcare decisions when you no longer have the ability and are not likely to regain that capacity for those complex medical decisions. If you have questions or comments, please don't hesitate to leave them. If we've, caused some confusion, you can certainly reach out to us. I know that what we talk about is upsetting information for a lot of people to hear, but we do think that these are conversations that need to be had. So I appreciate your attention today. Thank you for visiting our channel and for watching. And we will see you again and have more information for you then.
Hi, everyone. Thank you.
Thank you.